keynote speaker on the topic Drivers of Success in Digital Health.
Thank you so much for the honor to be able to present to your group. Really, really appreciate it. Can you see the slides? Okay.
Yes, it's okay. Yes.
Great. Okay. Thank you so much. So what I'll do is we've been working on telemedicine and digital health for the last 12 years. I just want to we have done probably well over 1,000 deployments, both in the US as well as globally. And I'll just share some insight on how do you think about some of the elements of how to do a successful telehealth deployment. And before I start, I'll just give you a bit about my background. So our company, we're most well known as the people who built a video telehealth system for the astronauts. In fact, for the last 6 years, 100% of telemedicine or video chat from the space station are done by a VC exclusively. Again, we're being able to, this is a picture showing that when the SpaceX, when they dock with the space station, so SpaceX actually runs VC in their cockpit as it connects to the space station. And one of the interesting things we do a lot of work is how do you create these sort of remote clinic? So this example from the Tesla, if you go to the Tesla car factories, they have these on-site clinic we design. So the idea you can easily do a remote physical exam on the employees, so bring the doctor virtually there. And then we've been doing a lot of work around the idea of remote patient monitoring and hospital at home. So you can easily have these sort of different patches a patient wear on their chest. And then this will allow you to track every heartbeat, every breath, continuous ECG, able to pull the data into the platform. You can make it very easy for a patient to get care. Not only these will extend the hospitals, but bring the services to the patient's homes in there. So again, finally, so we have been doing a lot of these volunteer work. So I personally been to Iraq 3 times. So we take these suitcase going to the refugee camp in Iraq, and this allows physicians remotely to see the patients in Iraq. And then we also did a lot of telesurgeries from Iraq. So this again, is the surgeries done by the Iraqi surgeons, but they're in consuls or the American surgeons, so they can actually deal with these very complex cases in there. So I personally been to Africa, about a dozen countries there. I've been to over about 50 countries doing these sort of volunteer medical work in there. And then what we found, one of the things is, you could actually deploy a lot of these telemedicine or digital health solutions fairly practically, because the internet pretty much in most places is actually fairly healthy and fairly strong in there. So what I'll do is I'll just share 8 secrets to when you want to, let's say you want to create a telehealth solutions. How do you allow them to be able to do it successfully? The first secret is I recommend is actually don't spend any money on this. So often you might find this surprising right now on the market. You're flooded with people try to sell you some stuff. We find is because telehealth is something that is very disruptive to your people processes in there. Often is if you use the wrong tool, you actually will get locked into something that's actually fairly damaging to your business processing or people processes in there. So it's almost like more money you spend, you have almost like a golden handcuff. You're locked into that system. So it's actually better to have the idea is just to try to not spend any money at all. So for example, just give you a sense of maybe how little money if you can spend. First is there are many, many free these were telemedicine software out there, things like Doxy and a bunch of others, right? You don't really need to spend much money on the hardware. Free is actually okay to get started. So we actually operate one of the Walmart clinics in Minnesota for about 3 years. And I'll just show you exactly what we spend. So there's already a computer in the clinic already. Or just you use that. We spend a couple $1,000 buying these sort of digital peripherals for the general exam camera, various things, and that's it, right? It's really meant to be like super lightweight on this. You can actually do these sort of telemedicine, and What was interesting, CVS, they found that 33% of the patients actually prefer video over in person. And at first, I was really sort of intrigued by the finding. Turned out when you do telemedicine, you can often find the patient actually have a display. They can see what they're seeing on the screen from the medical devices, give more chance to explain, and so on. And the as a continuation, so supposedly the next secret is now, suppose you have actually used these free products, you have got your telemedicine system going in there, then you actually have a patient volume that actually allow you to have a profitable operation. There's some extended we add is you could, for example, add in this some Pentel zoom cameras. One of the secrets is you could actually get these sort of Sony EVI camera on eBay and others for about $50. This used to be the workhorse of all the conference room in there. It's just a discontinued model from Sony. And this camera lasts forever. Like literally, it will last you $50 will last you literally the next 30 years. It's such a robust camera, easy to get and Pentel zoom option. We also recommend a bigger display in this. Okay, you don't need to spend too much money on this because when you have a bigger display, people engage and find a more engaging experience in this. And the nice beauty of this, an intern can do all these setup. You definitely don't need to spend any money like hard professionals and so on. Just like they can easily create this experience for you. Then the third secret is in telemedicine, there's like direct to consumer that people come to your website, or you could do within the clinic in there. We typically recommend you should do direct to consumer immediately because that often has the biggest impact for your service in there. But when you do the direct to consumer, often your technical support become a lot more expensive because just there's a wide variety of network devices you have to handle. But the beauty is if you have a 3G connection, it's actually good enough. You don't need to have 4G or 5G, all these things. Again, right now, these telemedicine platforms, they're pretty light on resources in this. And some simple things, just add a HIPAA video chat to your webpage. Really easy way for the consumer to engage with you. Then the fourth secret we highly recommend is, so when you do telemedicine, you have to train all your providers on digital best manners in there because there is this video presence, how you structure the video that often have a huge impact on the user experience. And often is if you have the great medical expertise, you give the wrong setup, that often could be not that great. And again, so I recommend is, for example, you could just for your staff, right? Just have them force them turn on the camera for everything, just for internal meetings, everything. So people build up these sort of video competencies in there. Another thing we highly recommend is adding the instant rating at the end of each video visit, what this data, have the patient rate this experience, give that information feedback to the provider instantaneously. And the nice thing about this is there's a lot of controversial topic is, how much should these patient rating even impact with the providers work? What we find is you don't need to do anything controversial. Just the fact you have a rating system, people naturally want to improve themselves. Your services will become that much better. Then the fifth secret is you have to market and communicate. So one of the big drivers behind a lot of digital health is there's a lot of these big players that have massive marketing budgets driving these. And if you don't have the appropriate marketing strategy, you will likely you could do a pilot, but you definitely will not have a successful deployment because it's just like people are flooded with these, telemedicine this or telemedicine that in there. You have to have appropriate telemedicine marketing strategy. There's some simple things like adding these free health check survey on your homepage, things like adding these videos on your web pages, create very engaging experience. And one of the things you could do as an exercise for your server, just click how many clicks you need to do until the patient see a smile, right? Often people don't do the exercise, they find there's way too many clicks until just cumbersome experience, right? Make it really easy for your patient to engage with your hospital or clinics. And then the sixth secret is focus on the providers in there. If you go to all the conferences like HIMSS, like ATA, like all these conferences, right? People will have themes, talk about patient engagement, patient this, patient that. We find it, in general, patients love these digital health, all these already, but it's the providers that often they have to spend a lot more time doing these sort of new technology in there. So you have to focus on the provider. If you don't do that, you will not have a successful experience in this. So for example, the big idea is video conferencing is not telemedicine. Telemedicine is your digital workflow, allow the provider to be very efficient, able to do their job in there. If you're not able to measure the time, for example, how effectively a provider able to do the telemedicine, it's just they're not going to adopt this beyond a pilot. The second secret is telemedicine and the digital health really allow you to transform your brick and mortar practice. So give you a lot of chance to reimagine what healthcare is like. So one of the big things, right, there's a lot of these sort of simple devices, for example, and one of the things we recommend is you have to invest in practical AI. What I mean by practical AI is there's a lot of these deep AI that Google, IBM, all these guys are doing, which is pretty exciting in there. But there's a lot of like simple AI that has, I think, has a huge impact immediately. Things like how does a new patient sign up within your practice with your hospital, right? There's some simple thing that will increase their workflow and productivity. How do you make sure the patients show up for the appointment? Again, these are really light AI capability. There's a lot of capability out there. And so these things like these are AI for example, who's going to watch all these data, like blood pressure data, glucose data, like the data is not going to work on this, right? Again, so you can have these sort of very simple, practical AI that essentially is not meant to replace the doctor, but to augment their time, right? Now you could track all these readings, there's a lot of low engagement, and this does not require this sort of deep AI research. These are just simple things actually within our grasp already. But the final thing is I recommend is just do it. What I mean by this, so there's crazy market hype, but like I said, no one really know what they're doing in there, right? If you could even go into people who've been doing telemedicine for years in there, right? So all these things we don't know. So chances are is you probably know as much as anyone else in there. So just do it, right? Just do your telemedicine. As you do it, we recommend the idea, just do 100 experiments in parallel. This allows you to do a lot of interesting things, refine your thinking. Then through that, your program will organically become more and more sophisticated. Again, you don't need to wait for 9 months and then decide what to do. It's better just start small, start fast, and do a bunch of experiments. And I recommend when you do these for experiment, always use the 3 key performance indicator to track the practice. The first one is just robustness of the system, because this will drive a lot of craziness on your program. Next is the productivity. So the idea you need to be able to measure how much front desk and provider and experience, just how much time they're spending on each of these. And then lastly, just measure the impact on your revenue. At the end of the day, right, you have to generate revenue to have a sustaining practice. Again, if you just have these 3 simple KPIs and do just a wild experiment, I think this will give you the formula to have successful adoption. Again, really appreciate the honor and the chance to share with you some thoughts. So thank you so much. Oh, I think your mic is muted, Dr.
So, thank you, Milton. We really enjoyed your presentation. I'm happy to have you here today with us. I think you have covered almost everything. I have prepared some questions, but I think that one is, which factors play the critical role in skyrocketing the digital health solution? Because now we know that since you are providing health services to NASA, somehow you have skyrocketed this. And what is you mentioned 8 secrets, but there must be something else.
I think my hunch is, if I look at so we do a lot of these, we're platforms used by a lot of these big brands and so on. I think just do the experiment, let the data drive your decisions. I think often one of the big mistakes is people say, here's telemedicine or digital health. They do this massive program, all these things, and often is they get handcuffed into some decision that they know is not good for their, but they can't change it because too many resources are poured in there. I think it's this idea, just like don't commit any research, do the experiment, but let data, right? So like when you just have the data dashboard, say like how many patients doing it, how much time provider standing, is the business impact. And then as soon as you have that data, you can feedback, right? Then the program organically will get better and better every single week. I think if you just do that, you're gonna have a successful program. What we find people have not successful programs, always they invest way too much things before they go live, and they get handcuffed into something they just can't, even though they know what they're supposed to do, there's just too much inertia, they just can't switch it back.
Thank you. Thank you very much. And on behalf of the